I'm Sally Tabor, and I first went into renal nursing and then became a director of nursing in a private hospital where I identified that the standards in the cosmetic field were below normal. I went then on to work at the Royal College of Nursing, responsible for the private sector, and again picked up a bit of the cosmetic agenda, became a surveyor for Health Quality Service. I set up Treatments You Can Trust at the request of a government minister, and I'm also responsible in the sector for the complaints process. Treatments You Can Trust is a register set up for practitioners who meet a certain set of standards and are prepared to adhere to those standards, and then we can assess their clinics to ensure that the environment is the correct place to work. The ambition is to ensure that patients requesting wanting to have a cosmetic injectable goes to a safe premises and is treated by an informed expert practitioner. The problems facing in the industry is that the cosmetic field is a growing field which crosses between the beauty industry and the medical side. But there are a number of unqualified people providing these treatments, which is totally inappropriate, particularly when things go wrong. It causes a mistrust in the industry. Patients can only see things going wrong. What the sector needs to do, it needs to ensure that it's proud to display those registrants who meet all the standards on a register, and to eradicate some of the unethical practice. What motivated me to get behind Treatments You Can Trust was the fact that patients were being treated by unqualified practitioners in inappropriate environments and not always knowing that the substance they were having was the right substance. So we created the phrase always background check to ensure that the practitioner is appropriately qualified, that the substance they're getting is the right substance, and it's done in the right environment. The importance of having a register is to ensure that patients who ask for cosmetic injectables or want to have cosmetic injectables know that the practitioner that is doing it is appropriately qualified, the substance that they're having is the right substance, and the fact that it's always done in the right environment. And that environment is in a clinic or behind closed doors, not at the back of a hairdresser's. The benefits of practitioners joining the register is so that the public know that they are a safe practitioner meeting all the standards, and it's good for the practitioner themselves to be proud of the standard they have reached, so they can show the Treatments You Can Trust quality mark to the patient and can be on the window of the clinic. We chose Northgate Public Services to provide the register. I have an awareness of the work that Northgate has done in setting up the joint register that is now very well known in 3 countries. And when Sir Bruce Keogh, who conducted the review of cosmetic interventions, came out with his review, he identified that it was a data-free zone. So why not go with Northgate Public Services, who have a very excellent reputation of collating and aggregating data that can be put out into the public domain, that will be for the benefit of patients to know exactly how things are going in the sector and what's safe and what's not safe. What I would like to see is the sector really works together to have a register that it values as a gold standard, and patients can trust that the practitioner they're going to or the clinic that they're going to is following best practice. I'm absolutely delighted with the Health Education England framework of qualifications that people undertaking cosmetic injectables, laser treatments should adhere to. I've been the industry representative on that, and I'm really pleased that it's in the public domain now. Unfortunately, it is still voluntary, but it's recommended that everybody adheres to this, and it's making sure the public are very aware that this framework exists and the qualifications that people should have to undertake injectables. For instance, to undertake giving of Botox and dermal fillers, it suggests that the person has a qualification up to level 7. Well, to my mind, that's going to create a very safe practitioner. The other thing I'm delighted about is that it recommends that a joint council is formed, and that is already starting to be formed. It would be excellent if the sector could work together, and what I'd like to see is Treatments You Can Trust be recognised as that register within the joint council.